This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Good. So my name is Megan Craig. I am a PGY3 here at UCF HCA Consortium. So we're at the Florida West Hospital. And then we have a couple others on with us if you guys want to introduce yourselves.
Hey everyone, I'm a PGY2 and my name's Roberto Cordero, and nice to meet you all.
Hello everyone, I'm PGY2. My name's Christina Ledbetter and it's awesome to meet you all.
So just a little bit about our program. We're a 3-year advanced program. We currently have 4 residents a year with plans on expanding to 6 residents in the next couple of years. We just graduated our first class this past June in some of our fellowship matches. One was interventional sports and spine at OSS Health up in York, PA, traumatic brain injury at University of Miami, and then someone went into hospice and palliative care over at UC Davis. And then the 4th person went into practums and is doing locums. We're an unopposed program. You're mostly one-to-one with attendings, except for when you're on your inpatient rotation where there's 2 residents per attending. A little bit about our hospital. It's HCA Florida West. There's 515 beds, and we are an advanced primary stroke center. Our rehab hospital is directly attached to the hospital. So it's really nice for if you need to transfer patients, or we're able to get consultants over to see our patients as well pretty easily. So there's 58 beds there. And just a little bit about our patients we treat. About a third of them are stroke and TBI patients. A third is orthopedic, major multiple traumas, and amputations. And then the other third is kind of split between some cardiac and pulmonary, spinal cord injury, and then other neurology like GBS or Parkinson's. Sorry, next slide. Okay, this is our core faculty members. So Dr. Susan Belcher, she's our program director. She is pain medicine trained. So we work with her a lot with our MSK rotation and doing a lot of ultrasound procedures and interventional spine procedures. Dr. Burton here is on inpatient rehab. He is associate program director. He does a lot of our stroke patients and ortho patients. Dr. Buckhalter, he is anesthesia trained pain medicine. He's very involved in our program. He leads a lot of didactics. He does our interventional spine training program that we'll talk about in a little bit. And we'll kind of help set up elective rotations that you have interest in. Dr. Terry is PM&R trained pain medicine. She's been involved with us doing didactics in our ultrasound course, but she just recently started this past month leading our consult service. And then we have Dr. Slobodian, who is our other inpatient rehab attending, who is spinal cord injury fellowship boarded. So he gets a lot of our spinal cord injury patients and the TBI patients. So just the different training sites we go to. So like we said, the West Florida Rehab Institute, Florida West Hospital, and then we rotate over at Andrews Institute for sports medicine, Clearway Pain Solutions on our MSK and pain rotations, Nemours Pediatrics doing different pediatric rotations over there, and Emerald Coast Neurology, which is where we go and do our EMG rotation. So this is just an example of our schedule. So during PGY2 year, you spend 6 months total doing inpatient rehab, and that's split up into 2 different 3-month blocks. And then you do inpatient neurology, musculoskeletal, which is the one with Dr. Belcher, pediatric rheumatology, pediatric orthopedics, and then a month of EMG. PGY3 year, you do 3 months of inpatient rehab, 2 months of consults, 2 months of MSK, again with Dr. Belcher, and then another pain rotation with Dr. Walsh, where you do a lot more advanced pain procedures with her and some minimally invasive stuff. Pediatric cardiology, another month of pediatric ortho. You do orthopedic spine surgery with Dr. Metzger, who does a ton of spinal cord stimulators and SI joint fusions. The month of sports medicine over with Dr. Hackle over at Andrews Institute, and then a month of research. And then PGY4 year is pretty flexible. We're able to tailor it to your interests and what you want to do. So still have to do your 3 months of inpatient rehab to meet the ACGME requirement, a month of consults, a month of MSK, and 2 months of EMG, and a month of sports medicine, and then 4 months of electives, which these are different electives we have set up, and more are getting added each year. So we recently got one over at South Lake Pain Institute over in Claremont, Florida, which is right outside Orlando, a month at Ortho, or a one over at Ortho, Alabama, for spine and sports up in Birmingham. A brain injury one over at Brooks Rehab in Jacksonville. There's one in Tampa at the Rehab and Electrodiagnostics practice, a rheumatology elective, and then you can rotate again if you want at Andrews, if you're interested in sports medicine and want another month there, with Dr. Metzger again on orthopedic spine, or with neurology with Dr. Cahill.
All right, I'm going to be taking over for the call schedule. So for inpatient rehab rotations, it's home call, obviously. As a PGY2, which is what I am currently right now, you are on call Monday through Friday to about 8 p.m. Mostly it's just med rec. So when you're at home, you'll just be doing the medications, and nurses will text you, and you'll just go through all the documentation and do those, as far as also handling your own patients. So inpatient rehab, there's 4 people right now. So I'm there's 2 twos. PGY3 and a PGY4. There's 2 services, Dr. Sabodian and then Dr. Burton. So one's more like a stroke, MSK-ish one, and then you have your more spinal cord TBI with Dr. Sabodian. PGY3s and 4s, the night call is only like 1 week per month during inpatient rehab, which works out because you do not mostly know all your patients and kind of know what's going on since we all sit together. And then your 1 week of night call on consults, and then 1 week during your research month. Call on Sunday afternoon and night is also something that is what the PGY 3s and 4s do. Weekend coverage for 2s. So you basically work the weekends your attending is on. So that's like 1 to 2, maybe like times a month. So I'm on my 3rd month right now of inpatient rehab, and I've worked I think I worked like 2 the first month, and then only just 1 each time. It's really manageable. Like I said, you know your patients really well. So when you're on the weekend call, it's really just not that bad. PGY 3s and 4s, they work the weekend that they are on the night call. So when they're on the night call, they also work the weekends, and that's usually pretty smooth as well. As far as like overall learning goes, so when we're thinking about our didactics, we have some resident lectures and some attending lectures by all our attendings. Didactics, we have Botox reps come here. We have guest lectures from different parts of the hospital. Sometimes our attendings will actually bring in people from other places to give us lectures when they think it's like a really cool topic. We also have career development, financial lectures coming through. It's really awesome to get that side that a lot of us, especially when we're med students, we really don't get a lot of that. So it's really nice as a resident to be able to experience that. Trauma series, so we get a lot of intros from orthodox, radiology, all kind of geared towards being able to know what happens in the acute phase so we can take better care of them in the rehab phase. Just going over medical legal stuff, again, a big plus, especially when you become a resident. It's something you may not think about when you're a medical student, but understanding that, especially in the PM&R setting with so many notes you're doing, it's really great to know. And a lot of our attendings are very good at it, and you just have to ask and they'll go on and on about it. Other things we talk about: physical exam, ultrasound curriculum. Dr. Terry is actually going through that ultrasound series right now. Super helpful, really in depth. Super excited to continue with that. We also do partner kind of with other specialties in the hospital. So pharmacy residents actually come in and they actually give us presentations on maybe a class of medications, just to kind of refresh us, as we get into more PM&R after your intern year. You kind of forget maybe those little nuances that classes of medications can actually help a lot when you're like, oh yeah, that's a complication of this medication that we start always. SAEs, so we get didactic and lectures geared towards the SAEs, which is an exam that most of us will take. I think it's in January. So really helpful just to continue being able to gear towards like more board prep and things like that. We do other lectures on AAEM as PGY 3s. CIS training with Dr. Buckhalter is a really big, awesome plus, especially if you're interested in pain. It rotates depending on like where you are in your rotation schedules, but Tuesdays you kind of meet with CIS and you go along with him, and he actually does show you like spinal procedures on some of the real life mannequins that we have, and it's in the C-suite. It's really awesome. I actually haven't been able to do it yet, but I'm excited to do that in October. Dr. Cordero and Dr. Craig actually are on it currently, so they can maybe attest more to that if you have questions. Botox clinic, I mean, that's a really great experience. I've never actually done Botox prior to this, so it was actually really great to see my second month of inpatient rehab. Grand rounds, I think everyone knows kind of what grand rounds is, so we still do that here. Journal clubs, super fun. We try to make it fun. We're going out, I think, to Casa Cantina for our first journal club tomorrow night, so we're all super stoked for that. And then you just have, just knowledge assessment tests known as CATs, quarterly on didactic. So again, that's just another exam to just make sure that we're retaining information. Usually it's very pertinent to our boards, and it's usually not that bad. Other perks that our program kind of offers, we have dedicated spaces in the actual rehab and in GME. So if you're a chief resident, so you have your own space as a chief resident. We have on the 6th floor a whole GME space for the residents of all different specialties. And then actually in the rehab unit, we have our own little room. So it's really convenient when you need to, run up to the 2nd floor and see your patients versus coming from the 6th floor on the acute side. So we're really lucky for that. We are employed by UCF, so that means we are eligible for PLSF, which is, I know, a big question. One of the biggest questions I had, since we're UCF/HCA, we are actually UCF employees. We have access to a lot of what UCF offers, including the library, which in my opinion is really great. I'm actually looking into things right now. Sorry, I'm on call right now, so that was my phone. But anyways, the library is a really great resource. And just database to be able to look up things that maybe you may not have if you were maybe in a private institution. You do get AAP and our memberships in Q banks, as well as AAP membership in Q banks. Dr. Bradham's textbook is something we're also getting. He's been giving us lectures, so we're super excited to get that. PM&R recap is something that's also another perk, as well as AAEM. So we get all of those provided to us. Cost of living, again, in Pensacola is relatively lower than other places, especially around the nation itself. You do get laptops, work phones provided to you, which is nice, just because you can separate kind of like your personal stuff, like your personal laptop and work stuff. Pensacola is super awesome. It has a lot of sports that we could cover. Ice Flyers is one of them. Again, I have not been able to do that yet, but a lot of our residents has been able to do sideline coverage with them, as well as UWF coverage, which is a local college around here. And there's multiple sports along with that. time off. So another big question I know that most people have is like, what is our PTO? So you get about 20 days of PTO, 10 sick days, and 5 conference days. I do believe that there is, as long as you use some of your sick days, they can roll over, but don't quote me exactly how that works. That's something I can definitely look into if anyone has any questions with that.
Yeah, can you guys hear me?
Yeah.
Okay, so I didn't know if my microphone was still on. So for sick days, at least for now, 5 get to roll over each year. So as a PGY4, you can stack up 15 sick days to use throughout the year, in addition to your 20 PTO days. Subject to change.
All right, thank you, Megan. Thank you, Christina. I'll be taking over now to talk about wellness and the area. Also, my internet connection is not the best as I am outside of the country right now, so please let me know if you cannot hear me. So in terms of wellness, we do have a cafeteria at Florida West Hospital, and there's prepackaged food, or there's the food that they make for you on the daily, and basically that's unlimited. Although there are 3 restaurants that you can go into the cafeteria: Chick-fil-A, Subway, and a cafe called the Drowsy Poet. Those aren't free, but we do get a healthcare discount of about 10 or 15% when you do purchase items from those 3 places. But again, if it's cafeteria food, that's unlimited, basically Monday through Sunday. Now, during grand rounds, we do have catered meals. It's usually Chick-fil-A, but we have had from other places as well, local restaurants. And especially on electives, we do have catering, especially if you're on electrodiagnostic or MSK in pain. It's basically a weekly thing that you have lunch or even breakfast at times. We rarely go over the 50 hours per week. You will more likely go over those 50 hours if you're on the inpatient side, but if you're on the electives, I rarely go over the 40 hours right now. You also have a roundtable with the program director every other month. Basically, that's just to go over comments, concerns, any questions that you have, but also to let them know anything that's been going on during your rotations, what you like about it, what you don't like, things that you can improve the program. I think we have great peer support, not just from our co-residents, but also the faculty and our program coordinator. They're there for us for any questions or concerns that we have. I really like that as a PGY2, we do have a PGY3 resident mentor. They've done this, so you get to start out with all the tips, tricks, and basically advice that they get to share with you so that you can hit the ground running. We also do have attending mentors, and it's one-on-one, and you can basically meet with them as frequently as you want. We also have quarterly resident wellness events. If you love water activities, this is a great place to live. If you don't, that's okay. We have bowling, movies, axe throwing, anything else you can think of that is available. Next slide, please. And about Pensacola, so we are like the farthest west in the panhandle of Florida. The next 1 or 2 exits is basically Alabama. We have one of the top beaches here. We're also near a place called Destin, or the 30A area, which has clear water. It looks like you're in the Caribbeans. We're home of the Blue Angels, which is basically like a formal aerobatic team globally, and they aim to showcase the skills and teamwork of like the Navy and Marine Corps through flight demonstrations and community outreach. We were founded in 1559, so we're one of America's oldest settlements. There's a lot of new restaurants and breweries in town, weekly farmers markets. There's gallery night once a month if you're really into art. And there's numerous festivals throughout the year, and that includes like music, art, food, anything you can think of. We're also only 3 hours from New Orleans, and we do have the Pensacola Ice Flyers, which is a great hockey team nearby, as well as the Blue Wahoos, and they play baseball. Next slide, please. These are just pictures of like basically wellness events and things that have been going on. On the top left is a lecture that we did not that long ago on the GATE cycle in front of like FSU med students. And on the top right, there's local 5K or 15K races that you can participate in. And in the middle top, that was an EMG lab with an EMG tech. It's a lot of hands-on activity for nerve conduction studies and EMGs. Next slide, please.
Yeah, I just want to plug, we have a whole team that's running the 15K this year. Myself, Roberto, and Christina are all a part of the team.
Yeah. And here's more pictures of our didactic series, which a lot of it is hands-on. That's Dr. Terry on the top left with the lower extremity special test. In the middle, we have Dr. Buckhalter doing the airway management. lecture. And then on the top right, we have the spinal intervention simulation training, which is great. We also have pictures of the therapy dogs, adaptive cycling, and then us bowling at one of our wellness events recently. And then here's our contact information, the program coordinator, the chief residents, and then Megan, Christina, and I, as well as our Instagram handle at UCF HCA _PM&R. And here's a great picture of us at the welcome dinner that we had a couple of months ago. Does anyone have any questions? I know that was really quick, but we are short on time. Yes, Jane had a question. We just had our first graduating class, and yes, the fellowship outcomes were TBI at the University of Miami. We had somebody do a pain fellowship at in York, Pennsylvania, and then somebody did a hospice and palliative fellowship at UC Davis. And our didactics are held either at the rehab conference room or the 6th floor GME. And we do have board prep incorporated into our didactic sessions. I saw that Claire had that question.
Yeah, and Claire, didactics right now are Wednesday and Thursday at lunchtime from 12 to 1:30 is protected time. So if you're on inpatient rehab, the nurses shouldn't be bothering you. Usually we log out of our chat. That way you can focus on it. And then we are incorporating board prep into the didactic sessions with doing like board review questions at the end of each lecture. And then the SIS training is, as a PGY2, you do 6 months of it, and then around 3 months of it, your third and fourth year. Usually we center it around when our pain rotations are. That way we can go in and practice on the mannequins, our injections before we go do it on our actual patients.